Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, guys. Welcome back. We're so glad you're with us today. So today we're going to talk to Dr. Megan Loeb. She is a pediatrician in Kansas City, and she works for Leawood Pediatrics, and she owns her own practice, and she has been a pediatrician for over 19 years, and she is a wealth of information and also just an amazing human. I don't know if you meet people in your life where you're just like, you are such a great person. Megan is one of those people for me. And she's going to break down neurodivergence and help us understand what it is, what we mean when we're saying that, and also how to support people in our community. So with that, let's get to Megan.
Thank you. It's so good to be here.
I'm so glad you're here. So we're going to be talking about neurodivergence today, because I think this is a word that gets kind of like thrown around and we may not really understand what it's encompassing. And so I think parents would appreciate having this word kind of broken down. So let's start by talking about what does neurodivergence mean?
Yeah. So when you think about neurodivergence, you break it down into kind of the words that it is, neurologic and divergence. And so what that means is in that individual, there's a difference in the functioning and the structure of their brain that's different than what we would call typical.
Yeah, that makes sense. And so we also have a term that people will say is neurotypical. So what does neurotypical mean?
Yeah. So a neurotypical individual is somebody that is developing or has developed along a way that we would consider typical in kind of our developmental and societal norms.
Yeah, so it's expected, right? Like they're meeting the
Yeah, exactly.
milestones. Yeah. Okay.
Exactly. Like they're doing what we kind of expect and anticipate as we learn, as we grow, all of those things.
Yeah. Okay. So what can we talk about what some of the diagnoses might be that would fall under neurodivergence?
Totally. And this has changed over time. And this is something I'm learning about too, is that we used to really apply this term just to individuals who have autism. And it's really expanded, I would say recently, to encompass a lot more than that. Because, I mean, individuals with autism are not the only people that whose brains are developed and developing and doing things kind of differently than what we would anticipate. So commonly, I think about people with ADHD.
Mhm.
I think about people with learning differences like dyslexia and dyscalculia. They also are under the blanket of neurodivergence, but it's even beyond that. So, recently, individuals with other diagnoses like bipolar disorder or different personality disorders, or even things like Tourette's and now even epilepsy are kind of under that big blanket. So, um, a lot of different individuals, and I'm missing a lot too. Even as I said that to you, I was like, oh, and Down syndrome. So, a lot of people.
Yeah. So it's actually such a big category, or like more of a blanket term that we're using to talk about your brain if you are neurodivergent or you have a child that's neurodivergent, is just processing things a little bit differently than we would expect in a lot of different ways.
Exactly.
Okay.
Exactly.
Yeah, that makes sense. So do you think that in your mind, like this neurodivergence is a disability? Is that how we're thinking about it?
I think that's a really complicated question, and I think it could be answered a lot of different ways. So to keep it simple and short, I would say yes, and no. You think about the term disability, and I think throughout history, we think of that as a really negative term, right? Like you're doing something wrong, and that's not what it is. It's just your abilities are different.
Hmm.
So, in that terminology, yeah, neurodivergence is a disability. But when we think about disability in the way that maybe we thought about it previously, not necessarily. It's,
Hmm.
hey, your brain does things differently, but that doesn't mean your brain does things wrong. Your brain does things right. It's just not in the way that every other neurotypical person might be used to.
Yeah. Well, and I think disability is like one of those things, like in my practice, I find that when parents are asking me about like getting accommodations for their kid, and I'm like, if we have to name it something, a disability, in order to get access to the services that we need for our kid to be supported and successful, I'm like, let's call it whatever we need to call it in
Mhm.
order to get that done. But when it's in terms of like talking about who they are, whether they're with this means they're not going to be capable of doing some things, I'm like, that's so based on your child, right? Like some,
Absolutely.
yeah,
Absolutely. I think you hit the nail on the head. Like, think of disability as a legal term, right? Like, that is a term that is going to be used in situations where you go, hi, my child needs some things differently, maybe in their educational environment because their brain works differently.
yeah,
Yes, that's a
yeah,
disability.
yeah. And so we can embrace that part when it supports our kid and forget
Totally.
about what everybody else thinks it might mean, right? Like we
Yeah,
just know our
right.
kid. It's just each kid is their own person. Cool.
Exactly.
Okay, so can you develop a neurodivergence or is it something you're born with?
Great question. And I would say for the most part, it's something that you're born with, but it can be developed too, whether it be through trauma,
Hmm.
whether it be because of a brain injury at birth or after birth, right? Like those kinds of things can lead to difference in the structure and function of how your brain works. And but a lot of the time they're things that are part of you from the beginning.
Yeah. I mean, that's a great point because I think concussions are something that
Mhm.
are happening or we're having more awareness of. And I
Mhm.
certainly have seen people that have had a lot of shifts in how their brain operates after that
Yes.
event or
Yes.
trauma in general.
Yes, whether it be something physical happening to you or something, emotional or psychological. So, yeah, all of those things can be factors.
Yeah, that's a great point. I love that. Okay, so what do you think is important for people to know about neurodivergence? Like, what do you want them to kind of take away from this conversation we're having about naming neurodivergence?
Hmm, that people are different. And let's embrace that, right? Like, we're not all the same and we don't all fit into the same box. And that's okay. And something that maybe 30 years ago we thought was not okay actually is. It's just this person, this unique individual sees the world differently. And let's, as a society, learn and grow with that, right? And let's help them.
Yeah, totally. I think that's a great message to just like embrace the difference and see how we can support.
100%.
Okay, cool. Well, this has been so insightful to just get a better understanding of what neurodivergence is and also being neurotypical. Because I think it's evolving. Medicine is kind of changing and psychology is changing, and we're learning so much about how the brain functions that it makes sense that we would be applying these terms to greater populations of people.
Absolutely. And this is ongoing. And I think we are all learning and growing too. I can speak for my field. There's been a lot that has happened in the last 10 years to help us grow in our knowledge of what neurodivergence is. But So it's ongoing more than anything else.
Yeah, us too. Yep. Well, thank you so much for your time today. It's been so great to hear your thoughts on this.
Absolutely. It was great talking to you too, Bryce.
Thank you so much again, Megan, for all of your thoughts and wisdom on this topic of neurodiversity. I don't really have anything to add because I think she did such an amazing job of presenting this. But I think just the idea that like we're all different and we all need different supports. And that's one of the beautiful things about life. If you like what we're providing, if you like our episodes and topics, please like and subscribe to us. Follow us on Facebook and Instagram and YouTube. And if you want to send topic requests, we're loving all the topic requests. Hit us up at accidentalexperts@gmail.com. Thank you so much and have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.